Let's stay with that story by Sharon Momanya. And of course, you're looking at the predicament of so many patients in the country who have been coming all the way probably to Kenyatta National Hospital in Nairobi to get medical help on some of the terminal illnesses that they have. Of course, this back and forth between governors and the national government was going on. So today, we're looking at the medical equipment that are being offered by the national government to counties, and you're asking what sort of benefits have they come with? Are there people who look back and now say this was actually a good idea? Was a devolving health function a good idea? And to help us answer those questions, we have Machakos Governor Dr. Alfred Mutua. Thank you so much for joining us on KTN Prime.
Thank you very much. I'm very glad to be here.
A good number of your colleagues have raised very many objections to this, and they have reasons to that. But your county was one of the first counties to actually accept these medical facilities. What is the one thing that made you accept these facilities?
Well, I looked at it this way. When you look at the allocation of funds that we've gotten, the national cake is shared in two ways. There's 15% of the whole budget is given to counties. That means we share 15%, 47 counties. The rest of the money remains with the national government. That is the 85%. The Constitution allows us to have an understanding between the national government and county governments and to sign an agreement for the equipment. So when I got the MOU, I looked at what the MOU said. I looked at where the money is coming from, where it's going. And my conscience was very, very clear about the equipment and what it is going to do for the people of Machakos. My colleagues, I know, had issues. How was it procured? How was it? But in my mind, I looked at it this way. This is not money that was going to come to me anyway. They are not going to take any money from allocation to Machakos County. So this is what I consider to be a grant. This is the same as an international organization, USAID, Danida, coming and saying, we have equipment for you. The only difference that it's only coming from the national government, which is another government. Okay.
You looked at the MOU, you understood it, and you decided to sign on behalf of your people. However, I'd like us to play a bite by Bomet Governor Isaac Ruto, and he was referring to the document that governors were supposed to sign, and he was very categorical. He said they did not have a chance to see the entire document in its entirety. Let's play that bite for you.
Equipment, tunaletewa to the last page na kuambia sasa weka kidole hapa. Tunawauliza and the other contract page 1 mpaka page 600 inasema nini? Wanasema hiyo umesomewa na Macharia. Ati Macharia amesoma hiyo ni sawa. Kwa hiyo weka tu kidole hapa.
Governor, are you the only one who got to have a look at this entire document?
We know everybody had a copy of this document. We went to a meeting with the governors. We were all given copies of the documents.
The entire document?
It's entire document. It's a simple, I think 4, 5, 6, I can't remember. But it's about several pages, about 10 pages. And it's very clear. I looked at it. I took it back to my county. I gave it to our Attorney General and Legal Office. They looked at it and they advised me. They wrote to me an opinion. I looked at it. I called the Ministry of Health. I called the Ministry of Finance. Where's the money coming from? And I realized it's about time. And then I looked at the bigger picture. What is the national government trying to do? They are trying to have services that cut across the country that are similar. So that now, if you fall sick in Kisii, if you fall sick in Kilifi, if something happens when you're in Mandera, regardless of where you are or where your relatives are, they can get good x-rays, they can go to good theaters, they can get state-of-the-art equipment and treatment that they deserve.
You looked at the document, you were fine with it, you looked at everything, it was in order. However, some of the governors have raised issues about training of the personnel that are supposed to handle some of these facilities. How have you dealt with that?
I don't know. You know, we are lucky in Machakos, I have to say, compared to some of my colleagues, because I had already intended to purchase this equipment over time as a government. So for example, we had already planned to put up an ICU unit in Machakos. So we'd already taken 15 of our nurses to Moi Referral Hospital for training as ICU nurses. We'd already started recruiting doctors and more surgeons to work on some of the things that we wanted. So when this equipment have come in, we had already started training our radiologists. So it was like an added benefit. So we are a bit ahead of some other counties because we had already planned ahead, because these are services that I had already planned in my provision of healthcare, which is very key in part of my manifesto. So, but then when these equipment are coming, the technical advice of how to use the equipment and what happens when they break down is still being borne by the people who supply the equipment. So the national government has signed contracts with, for example, GE, who are supplying the X-ray equipment. If it breaks down, it is not my responsibility. The GE people come and fix it for the next 7 to 10 years. So these things of equipment falling apart because you can't get a spare part are not there. The GE people came, for example, and all the other came, and they gave my people intense training, because setting up the labs takes 2 to 3 months. During that time, the radiologists were taught, and it's not difficult. For example, you know, they may be new equipment, but it's like upgrading from driving a Pro Box to driving a Mercedes.
Okay.
It's still the concept of driving is the same. You keep left, you signal, and you turn right and left. You know, the concept is the same.
So basically, these issues that are being raised about training, about specialists by your colleagues don't make sense to you?
Well, they may make sense to them because maybe of their situations. In Machakos, we don't have that problem.
You're way ahead.
We don't have that challenge.
You're way ahead.
I don't know whether we're ahead, but we planned ahead.
Okay.
We planned ahead as part of our program to provide healthcare, because we are also building 40 new community hospitals, which we are launching in Machakos County this August. And each of those will have an X-ray, will have a ward, will have a maternity, will have a mini theater, will have lab services, so that healthcare is closer to my people.
What difference have you seen since this equipment came to your county?
Oh, it's tremendous. Oh, my goodness, it's tremendous. Especially you look at dialysis. People used to come all the way from Machakos County to Nairobi for dialysis. You look at some of the X-rays that are being done. Now you look at cancer screening. You know, even our mothers now can get cancer screening right at home without them coming to line up in Nairobi or pay the high fees of being brought to Nairobi. So I've seen a lot of changes. You look at maternity, for example. We've got a state-of-the-art maternity theater, so that when our mothers are giving birth, once the baby is born through C-section, there's already, not only that, there's another unit, special unit for the baby. So the treatment kids are getting right now in Machakos County when they are born in theaters are the same ones you're receiving in London, in New York, in Hong Kong, in Sydney, Australia, in the best of the best in the world.
All right, so I'd like to play another bite by a lady who was sharing her concerns about the devolution of health, whether or not it was a good idea for the national government to devolve health. If we could have that bite.
I think we made a grave mistake in fully devolving the health functions to our counties.
Do you share her sentiments?
No, I think people need to move in and stop being stuck in the past. Let me tell you, before I became governor of Machakos, there was perennial shortage of drugs. There was perennial shortage of basic treatment. Because the national government was centralizing everything, was being done from Afia House, which some people had even termed Mafia House, because of the cartels and all the big monies that go into health. Now, because we are dealing with health in Machakos, I'm able to address those issues. Dispensaries that are not functioning are now functioning. Things like ambulances. You know, I bought 80 ambulances for Machakos County. Our mothers are not being ferried using wheelbarrows or dying by the roadside, bleeding to death, because they can't get to hospital. So we have been able to do so many things. Our hospitals have drugs, people are getting good services, and now we're even renovating our hospitals so that our public hospitals look just as good as private hospitals.
Okay, part of the reason why we're having this conversation is to help thousands of Kenyans out there who are suffering from many diseases out there, and probably who would have otherwise be forced to come all the way to Nairobi to get medical help if they need it. And let's listen in to some of the bites that we had from people who, from all over the country, people who have concerns about how they will be able to get medical help all over the country.
Sasa nikakaa juzi wakaniambia natakiwa uende Kenyatta ufanyiwe radiotherapy. Baada ya radiotherapy ukae 1 year. Alafu hiyo 1 year utakuja ufanyiwe craft.
Wakawa wametuambia next booking itakuwa ni 2016 December, ndio anaweza kupata slot ya yeye kufanyiwa radiotherapy.
Okay. So assuming there are thousands of Kenyans out there who probably have had to endure long lines at Kenyatta National Hospital, are you now telling them it's okay, you can come to Machakos County, you will be able to get these facilities, assuming their counties have not yet installed these facilities?
No, I don't want everybody trooping to Machakos, you know, because then we'll have a big problem handling the numbers.
Yeah.
But what you're telling people is that once you've got the facilities in Kakamega, in Bungoma, in Uasin Gishu, in Bomet, everywhere in this country, in Kilifi, everywhere, then our people don't have to wait for 2-3 years.
In
for
the meantime,
booking.
can they come to Machakos?
In the meantime, everybody is welcome to come to Machakos. You're welcome to come to Machakos. We will not turn anybody away. If you're also a health practitioner and you want to work in a good, conducive environment, please come to Machakos. We are looking for doctors. We are looking for more nurses. We just put an advertisement. We want to hire 200 new nurses, nutritionists, lab technicians. We want to hire 50 new doctors. And if we get 100, we'll hire all of them. Because I want better provision of services to my people. And it doesn't matter where you come from Kenya. Come from anywhere. You come to Machakos, we work with you.
All right, so if you're a medical practitioner, Dr. Alfred Mutua says he has vacancies in the county of Machakos. You need to make your way there. Finally, before I let you go, Bwana Governor, you launched something today in Machakos County. What was that about?
Today we launched a film festival called Machakos Fest. What you're doing in Machakos is as part of my economic pillars. We launched Vision 2020 the other day about where we are coming from and where we are going. And we have to provide employment and also support to our youth in the activities. And so we are telling everybody, we've got this short film festival. If you have a camera, if you don't have a camera, use your mobile phone to shoot a 7-minute film. The winner will get 1 million shillings. Second place is get 500,000. We'll get your movies aired on television so that we can promote the local industry and provide employment for our people. The other few weeks ago, we had in conjunction with 7 Seas and Safaricom, we launched Zaba, whereby you can register, put your CV online, and once it's there, we get employers to look at that and hire you. So I'm trying to find ways of moving our young people from just sitting at home worried to getting them to hooking them up with employers or innovative ways for them to get jobs.
You do realize in those few minutes you've just advertised for medical practitioners and film experts.
No, it's good. What we're trying to do is that in Machakos we play something called politics of development, which we call Maendeleo Chap Chap, which means proper development that is focused on the mwananchi. That is why in Machakos you don't see us commenting a lot on the political issues, political wrangling, political dancing here and there. We are focused on mwananchi, and that's what matters. We call it Maendeleo Chap Chap.
Machakos Governor Dr. Alfred Mutua, thank you so much for joining us on KTN Prime and to help us understand the benefits that your county has so far seen with the medical equipment leased by the national government to counties. You're watching KTN Prime. You're taking a short break. We'll be right back.